Hi everyone, welcome back to Geriatric House Called Dentistry and the dentist from the Palm Beach area. We have Dr. Jairo Sanchez and Lou's hygienist. Today we are going to talk about extractions. Now this is a crazy subject because people are like, you are gonna do surgery in the house? Is that possible? Absolutely. It's one of the easiest things that we can do in the house. I shouldn't say it's an easy procedure, but it's easy for us because we're really good at it. So before we do an extraction, we need to know if they're on blood thinners, if they're on Xgeva, if they've had any osteoporosis medication. We do all that. So you're thinking, do you do that? Yeah, of course we do that. But going to the procedure, let's talk about what to expect. All right, so what are the steps before we get there, and then how do we extract the teeth in the home?
Of course, so always we get a call that somebody's in pain, something broke, there's an abscess, a swelling.
Loose. Or it's loose.
Yes, so once that happens, we know there's something going on that's a little more extensive and will have to be addressed immediately. So we always take an x-ray to see what's going on under the gums, under the bones, the things that we can't see unless we take an x-ray.
Well, what if they can't take an x-ray because they have dementia and they're screaming? Can you use an old x-ray from the last dentist?
We can, absolutely.
Okay.
So we can contact the old dentist, we can evaluate those x-rays and see what was in that area. After that, we always go over medical history, just like we discussed. Make sure that the patient is stable for any procedures because extractions are a surgical procedure. And if that's the case, we can proceed. We make sure the blood pressure is okay before we do anything. We anesthetize the patient so that they don't feel anything at all with topical anesthetic and then some local anesthetic. And once we know that everything is numb, we can remove that tooth.
And do you usually do something so that the bleeding stops? Do you use any collagen plugs?
Absolutely. So we have different materials that we can use to stop the bleeding, especially for anybody taking any blood thinners. We want to make sure that we stop that bleeding before we leave the bedside or wherever you are. So we use collagen, we use things called Healy plugs to stop the bleeding, and we can also put some sutures in there. That way the tissue is nice and tight and there's not gonna be any more bleeding.
Right, and you stay and give directions to the aide and they have your number. We have this down pat, right? So if you're worried about a loose tooth or you're worried about your loved one's broken tooth, don't ignore it. Don't ignore it because it doesn't get better. It doesn't stay the same. Things just progress. So you wouldn't leave a broken bone untended to, right? So this is the same thing. You must always check if something looks wrong. If it looks wrong, it is wrong, right? That's what I say. So if someone calls and says, there's a root there. And by the way, we might not take the tooth out. We might go in there, it might be a root tip that's fine. We might evaluate it and say, we don't have to take this out. So it's all about getting knowledge and getting an opinion from experts who know. So we will take an x-ray if at all possible. And if we can't, we'll get the old x-ray because the tooth morphology doesn't change. So we have to have to do an extraction. We know what the root looks like from the old x-ray. So it's always important to try to get those x-rays anyway. Any other advice?
Just make sure you keep your oral health, a priority. Give us a call every time you need anything with any sort of emergencies. Anything feels wrong, just let us know and we'll make sure we let you know if everything's okay. If not, we'll take care of it.
And you have Lou's, the hygienist. So if nothing is wrong, you should get your teeth cleaned.
Try to have your cleanings every 3 months. It's very, very important.
Right.
We have a lot of patients, they lose their teeth because they don't go to do the cleaning.
So if you're not taking great care of your teeth, it's especially important to have the hygienist come and evaluate you. Maybe it's every 6 months, but maybe it is every 3 months. And I have patients who will not let their caregivers brush their teeth. So I go there every month and clean their teeth. Because you know what? It's so great to be proactive instead of reactive. A healthy mouth leads to a healthy body. So great chatting with you guys today. And if you have any needs in the Florida, Palm Beach area, from Jupiter to Fort Lauderdale, and in between and on the sides, and maybe so and maybe not, but give us a call at 866-686-4423 and look at all of our videos on geriatrichousecalleddentistry.com. So, bye for now.
Bye.
Bye.